26-year-old female, intraventricular hemorrhage, somnolence and disorientation. On our left, we have her CT scan showing intraventricular hemorrhage on the right lateral ventricle. Here is the frontal horn. Here is the occipital horn. Here is the atrium. And also here at the pulvinar of the thalamus, and may be part of the lentiform nucleus, the posterior part of it. Here on the right side, we have the MRI showing the image very suggestive of AVM occupying the pulvinar of the thalamus, extending very close to the third ventricle, close to the midline, extending all the way to the atrium, the anterior wall of the atrium. Here is her MRI. You can see the blood, the clot over the pulvinar of the thalamus. And here we have the sagittal cut of this same hematoma we're looking at. So where is this hematoma located? So where is the location of the AVM? It's in this area. Here is the thalamus. We can see here the posterior part of the thalamus is a pulvinar of the thalamus. And here we have the fornix. And here we have the choroidal plexus. And here between the choroidal plexus and the fornix is the choroidal fissure over here, tinea fornicis. This is the angiography of our patient. AP view on the left and the lateral view on the right. So this is the vertebrobasilar system. Basilar artery, PCA, PCA. Basilar artery, PCA. On the arterial face, we can already see the vein, the internal cerebral vein, the vein of Galen, and then straight sinus. The internal cerebral vein, the vein of Galen, and straight sinus will be projected here. So this is the basilar tip, basilar bifurcation. So if we project, we could go above, we can see this is the location of foramen of Monroe. So we can see the nidus is located behind, way behind the foramen of Monroe, right above the internal cerebral vein, and it is projected, extended very close to the midline, but then goes laterally. So what arteries can participate in the supplying? What arteries can supply this AVM? In this location, on the lateral ventricle, is going to be supplied by the lateral posterior choroidal arteries, and maybe and probably will be supplied also by the medial posterior choroidal artery that runs with the internal cerebral vein on the roof of the third ventricle. So it must be supplied by both, laterally and above by the lateral posterior choroidal artery, and close to the midline here, close to the midline, and below by the medial posterior choroidal artery, and they will drain towards the internal cerebral vein to the vein of Galen and finally to the straight sinus. So here we have a second chance for those who still don't understand where the AVM is located. So let's see the lateral projection of the angiography again. Here is the foramen of Monroe. Here is the foramen of Monroe. And then here is the internal cerebral vein. Here will be the internal cerebral vein. Why is not here? Because this is a lateral ventricle. This is the roof of the third ventricle, at least the lateral projection. Okay, and then vein of Galen will be running here. So the internal cerebral vein will be running here, and then vein of Galen, and then straight sinus. So the AVM is located from here to here. This is the location of AVM on the lateral ventricle at the pulvinar of the thalamus. Let's see the AP view. You can see the AVM extends from the midline, then laterally. Here we have the pineal gland, internal cerebral vein. So here is the midline, the colliculi superior and inferior colliculus. Midline, the AVM does not reach the midline, but comes very close. So it's here at the pulvinar of the thalamus and extend laterally. So this is the location of our AVM. So the patient underwent right posterior parietal craniotomy, and he's doing an inner hemispheric approach to this AVM. This is a vein of Galen, and he's dissecting, cutting the arachnoid to see better. This is explaining of corpus callosum. He knows that an AVM comes very close to the midline, but it does not reach the midline and extend pretty laterally. So he needs more exposure laterally. Now he's removing a piece of cingulate gyrus to get a more lateral exposure. So he's not doing the callosotomy over here, but he's doing over here. Since the AVM is located at the pulvinar of the thalamus, we have to remember that the pulvinar of the thalamus is the medial part of the pulvinar of the thalamus is the anterior wall of the quadrigeminal cistern, and the lateral part of the pulvinar of the thalamus is actually the anterior wall of the atrium. So what is the division? What's the limit between them? It's the choroidal plexus, the choroidal fissure. Now he has removed the cingulate gyrus, and then here we have the corpus callosum, the splenium of the corpus callosum. He's trying to explore below the corpus callosum and see the feeders, the possible feeders of this AVM. More lateral will be the lateral posterior carotid artery. More medial will be the medial posterior carotid artery. Now he's removing part of the splenium of the corpus callosum over here. By removing the corpus callosum, we are expecting to get into the ventricle anytime. So far we have the he has reached the ventricular cavity here. So this part of the pulvinar is the anterior wall of the quadrigeminal cistern. You can see the choroidal plexus. So this part, intraventricular part of the pulvinar, is the anterior wall of the atrium. So choroidal plexus is over here. This is medial to choroidal plexus, so this should be the fornix. This is the pulvinar of the thalamus, that is the anterior wall of the quadrigeminal cistern. His coagulating feeders of the medial posterior carotid artery in this region. separating, he's dissecting the choroidal fissure. This is a pulvinar thalamus. This is fornix. Thalamus, fornix. Choroidal plexus is over here. So he is at the pulvinar of the thalamus. That is, this part is the medial part of the pulvinar. So it is the anterior wall of the quadrigeminal cistern. Now he's coagulating around. He's doing circumferential coagulation of the AVM. He has found a PL plane to dissect around the AVM. Coagulating, cutting. We all remember that the AVM drains into the internal cerebral vein towards the vein of Galen. So it's coagulating around the AVM. So the medial part of the AVM, it has to be supplied by the medial posterior carotid artery. Then finally, the draining vein towards the internal cerebral vein is being cut, being coagulated, and then now being cut. And this is the removal of the AVM and the final aspect of the surgery. This is the postoperative angiography of the patient, showing a total removal of the AVM. And this is the postoperative MRI of the patient. See where the surgery was performed is right here. After the surgery, she was fully alert. She presented no motor deficit or any eye movement disorders. But we don't have memory or neuropsychological testing available to evaluate if there any memory dysfunction because of the manipulation of the fornix and partial removal of the splenium of the corpus callosum.